Hello, my name is Dalmer Staley, and I'm going to talk about the mock session that you're just about to see. So this is a mock session with a pediatric patient. It is with one of my classmates. I let her choose what age she was going to be. I just asked that it be within the pediatric range, and she said that she would be an 8-year-old girl in the hospital. I didn't want them to choose any diagnosis or anything like that, but just be a child in the hospital. So just to start out and let you know, all these experiences that I did are really abridged versions of some things that I've done in the past. Definitely, I just wanted to keep it within a 15-minute time period and not expand it, because definitely this whole session could have taken up to a good 25 to 30 minutes if I had really expanded it and done almost all the stuff that we normally do in these experiences. But I started with a hello song, a really nice one that I adapted from the Beatles. It's called Hello Little Girl. It's a nice one to really create a musical space for the client to enter in and to engage in. It allows me to say hello to them, which is very nice. They realize I know their name, and it has a really nice syncopated swing feel rhythm, and allows the client themselves to say hello to me. And then what I did in this mock session is what I usually do for clients who are a little more timid with the instruments that I bring. We said hello to the instruments, which really engages the client to not be as afraid and to play the instrument by doing a funny thing, by saying hello to them. So we said hello to the drum and the piano, and normally I would have had many more instruments for her to say hello to and things like that, but again, I kept it abridged so to stay in a 15-minute time period. Then from there I did a check-in. I used a visual sheet. That's something I really like to do with pediatric clients. It gives them a visual to see. Sometimes it's hard for pediatric clients to express how they're feeling, and so I use these laminated visuals. They're on a laminated board, and they themselves are laminated and have Velcro on it, so that the client could even remove them, or I can interchange them as needed. It's a really nice way, and it's cleanable. So I used that in my clinical site last semester, and it was very, very beneficial to have that, to really have something for the clients to see. It was a good thing to use also for clients who were trached or just didn't want to talk to me, who were done with being asked again and again and again, how are you feeling today? How's your pain level? So it really, really was an excellent way to engage clients who just maybe didn't want to be engaged, and suddenly there's a visual for them to see. Then from there, I brought in an experience that I really like to do with pediatric patients. I call it I Like to Eat, and so I offer another visual sheet. This one is foods. As you can see, lots of different foods. Again, laminated, Velcroed. I have multiple different types of sheets with different foods on it that the clients might enjoy. And so especially I found pediatric patients in the hospital, they're eating stuff or sometimes can't even eat because they're on an IV or about to go into surgery or different things like that, but they really enjoy talking or singing about things that they like to eat. Really, it's an expressive thing for pediatric clients to express, say, I'm an individual and I like to eat this, but maybe my parents don't like to eat that, things like that. So it's a fun way to engage the clients. So in the mock session, we sing about things that she likes to eat and then things that she doesn't like to eat. That's also another way for the client to express themselves. And in this, I am assessing receptive and expressive language, cognition, different things like that. Fine motor, if the client's grabbing the pecs, different things like that. Then in the mock session, I go on to ask things that she likes to do, and that's another fun thing. I have pecs for that, but this time in the mock session I didn't. I wanted to see if she could come up with things that she liked to do without having the visuals, which she was able to. Then from there, I directed her towards the piano and made a seamless transition from that experience over to piano playing and piano improvisation. So I used the Song in My Tummy, which is a really nice song by the Laurie Berkner Band. It does body awareness, lots and lots of different things. And with fine motor, gross motor, having to sit on a piano bench, depending on where I do the experience. And then from there I used that to do a rondo form with improvisation. So we would sing the Song in My Tummy, and then go into more of a piano improvisation, and then come back with singing about a different part of our body, and then back to improvisation, and then a different part of our body, and then back to improvisation. So it definitely allowed the client to express musically what different parts of their body, and then just musically express on the piano. I made sure that it was all within white keys, within the key of C, so that she could play any of the white keys that she wanted, and that it wouldn't sound wrong, and it was geared for success for her. Then from there, I sang a goodbye song, which I like this goodbye song because it is very, very soft and gentle, not a lot of words. It's very easy for clients to comprehend, and it's a nice song to use ISO principle to draw a client from maybe a high state, emotional state that I might have brought them to with the other music, and then draw them back down. Because in my clinical site previously, the nurses did not appreciate when I left a client in a higher state of energy, and enjoyed it when I would definitely use more of an ISO principle and draw them down before leaving. So that goodbye song is really nice for that. In the mock session, I kept it in C so that my client could continue playing on the piano. I used guitar picking. I modeled body positioning and different things like that. So I hope you enjoy this mock session with a pediatric client. Thank you.
Hello, Julia. Hello, Julia. Hello, Julia. Hello, Julia.
Hello.
My name is Damaris.
Hi, Donna.
Let's say hello to some of the instruments that we have in the room.
Okay.
Let's start with the drum kit. Hello, drum. Hello, drum. Hello, drum. Hello, drum. Hello, drum. What else can be an instrument?
The piano.
The piano? All right. Shall we just wave to it?
Yeah.
Hello, piano. Hello, piano. Hello, piano. Hello, Julia. Hello, Julia. Hello, Julia. Hello. 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 So, how are you doing today, Julia? I've got this sheet.
Say happy.
Happy? Very nice. Let's see. I'd like to know some things about you. So, some things that maybe you like to do, and some things that maybe you like to eat, and we're going to sing about them.
Okay.
So, let's start with things you like to eat.
Tacos.
Ooh. Julia likes to eat lots of lots of gravy on top of them. She likes to eat lots of tacos and lots of candy and lots of mashed potatoes. Is there anything that you don't like to eat?
Yogurt.
Yogurt? She doesn't like yogurt. No, she doesn't. She doesn't like to eat lots of yogurt. Anything else that you don't like or maybe do like?
I like steak.
She likes to eat lots of steak. She likes to eat lots of steak. Now that I know some things that you like to eat, what are some things that you like to do?
Play with puppies.
Julia likes to play with puppies. She likes to play with puppies. Anything else?
Swim.
Julia likes to swim in a pool.
Sure.
In a pool. She likes to swim in a pool. Anything else?
Sleep.
She likes to sleep all night long. She likes to sleep all night long. She likes to sleep and sleep. She likes to sleep all night long. Let's see, what else?
I like to color.
She likes to color all the time. What are your favorite colors to color?
Purple.
She likes to color things purple. She likes to color things purple. She likes to color things purple. What about playing instruments?
Yeah, I like that.
How about the piano?
Yeah.
Should we go and play it now?
Yes.
All right, let's go. She likes to play. Let's get it right here. She likes to play. You can play any of the white keys. The piano. She likes to play the piano. She likes to play the piano. She likes to play the piano very loud. She likes to play the piano loud. She likes to play the piano softly. She likes to play the piano softly. That's a nice piano playing. Thank you. Let's see. I think that we should sing about a song, about things where we have songs. So we can have songs in like our tummies and in our voices and in our fingertips.
Okay.
So you again can play any of the white keys.
Okay.
I've got a song in my tummy and it wants to come out. I've got a song in my tummy. I've got a song in my tummy and it wants to come out. I've got a song in my tummy. I've got a song in my tummy and it wants to come out. And when it does, we're gonna sing and shout. Fa la 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 la. I've got time where I do my song. Again, you can play on the piano.